Hi everyone, good afternoon. First, let me introduce myself. My name is Maricel Piloni. Today, we will discuss about what is depression. Ano nga ba yung depression? Sa palagay niyo, ano yung depression? The second is, what are those symptoms of depression? Yung mga sintomas ng depression, ano kaya yun? And the last is, what are those treatment about depression? By the way, let me introduce to you our short film video. Kaya, stay tuned!
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression. and the better the treatments will get.
Depressive disorder is different from just any sadness that comes from disappointment or sorrow. The word disorder means an abnormal physical or mental condition. Patients suffering from depressive disorder or depression are in a longer state of sadness than normal, to the point that it disrupts normal daily activities because of symptoms like insomnia, inability to focus, lack of appetite, complete loss of interest. Everything just seems terrible. Depression can come from many different causes, like genetics and chemical imbalances in the brain, but it's most often triggered by a traumatic event, like the loss of a loved one or personal failure. Just because someone is suffering from depression, it doesn't mean that they are weak, give up easily, or are unwilling to tackle a problem. But due to the illness that has occurred to their mental state, it means that they are not ready to face the issue. It's like being in a pitch-dark room and no matter where they turn, they just can't see the exit. But with proper help and supportive peers, it's like there's a helping hand in turning on the light, which guides them to solving their problem on their own and returning to their regular lives. Many of you are probably wondering if perhaps you fall into this category too. Let's see if within the last 2 weeks you have experienced any of the following symptoms. 1. Feelings of discouragement, sadness, or despair. 2. Complete loss of interest in activities or hobbies. 3. Loss of appetite or extreme overeating. 4. Insomnia or excessive sleeping. 5. Feelings of anxiousness, restlessness, or complete lack of motivation. 6. Fatigue, easily decreased energy. 7. Feelings of worthlessness and disappointment in oneself. 8. Lack of concentration, focus, memory retention, and inability to make decisions. 9. Suicidal thoughts. If you have experienced more than 5 of these symptoms almost every day within the past 2 weeks, it could mean that you are at risk of having depressive disorder. But before diagnosing yourself with depression, you should consult a psychiatrist who can offer you their professional opinion after conducting a detailed analysis. Seeing a psychiatrist or psychologist isn't unusual or something to be ashamed of. It's an incorrect assumption that those who seek mental health professionals are insane. In reality, those that are suffering from stress or complex issues with no one to confide in can also consult a psychiatrist or psychologist. Mental disorders are exactly like physical disorders that require specific consultation. It's the same as if your teeth hurt that you see a dentist or your knee hurts that you see an orthopedist.
Hey Psych2Goers, and welcome back to another video. Your love and support have enabled us to send your way another wealth of everyday psychology. So let's explore. Having depression is nothing to be ashamed of, and it doesn't make you weak or faulty. Even though depression is a prevalent mental illness, it still carries its stigmas the world over, causing not only less awareness, but also fewer people seeking proper treatment of depression. Depression that goes untreated can have some pretty detrimental mental and physical side effects, making its treatment paramount. Untreated does not just mean not having seen a therapist for it, but more so that the depression still requires attention in spite of seeking help. Also, it's important to restate that this video should not be used to self-diagnose. Rather, its purpose is to inform and create awareness. If you find yourself relating to the signs mentioned, please ensure to seek professional help instead of self-diagnosing. Here are 9 signs to look out for, suggesting untreated depression. 1. Memory impairments. Research shows memory impairments due to depression can be of the same nature as in dementia, though it isn't a harbinger of it. According to a 2003 study, long-term untreated depression is strongly associated with volume loss in the hippocampus. What does this mean? Well, the hippocampus is a part of the brain largely involved in sustaining your memories. So volume loss in this area could mean that you have a smaller capacity for long-term memory and could start to forget more than normal. 2. Substance abuse. Depression often makes you fall prey to addiction. If untreated, it can lead to severe substance abuse regardless of age or gender. Experts agree to the two being comorbid and likely to occur together more often than not. So if you find yourself more vulnerable to substances in the wake of depression, it is so important to heal properly. so that these conditions don't feed off each other for the worse. 3. Inadequate sleep. Do you find yourself dozing off more often, or does sleep completely evade you? Either way, sleep disturbances are now considered to be fundamental in diagnosing depression. A 2008 study shows that these sleep disturbances can look different for everyone and have lasting effects throughout the day. Many patients in the study said that they lack concentration during the day and feel lethargic. While it may make more sense for these sleep-related disturbances to occur at night, remember to monitor your energy levels during the day as well. They can tell you just as much. 4. Impulsivity. Are you drawn to out-of-character or risky behaviors lately? Self-destructive behavior is not only to numb the pain, but also to publicly cry for help. While it may seem logical at the time, it can negatively impact both the body and the mind. Physically, risky behavior can lead to harmful infection and damage throughout the body. Psychologically, its numbing effect of the body can be a hindrance to coping in a healthy way. Depression can bring about feelings of hopelessness and despair, but remember that no matter what, you are worthy of love and healing. 5. Appetite changes. Have you noticed a change in the way you eat? Are you overeating, or have you lost your appetite completely? Eating differently than normal can be an underlying sign of untreated depression. Psychologically, appetite changes and increased unhealthy cravings are types of coping mechanisms and can indicate that there may be something larger worth paying attention to. 6. Frequent migraines. Migraines and depression commonly coexist, but when depression goes untreated, the intensity of these migraines can skyrocket. The migraines run the risk of going from episodic to chronic, which means they go from happening less than 15 times a month to more. Although the reason for this occurrence is not fully understood, it's important to not let depression go untreated so that migraines don't develop or become worse. 7. Social isolation. Do you feel a constant urge to stay under your covers all day? Does interacting with friends and family sound draining? You may be isolating yourself as a result of untreated depression. You may develop low motivation and disinterest in everyday activities. Isolating yourself because of depression can actually bring about loneliness and worsen symptoms that are already there. Even your routine seems an impossible feat as depression drains you of yourself. 8. Increased somatic pain. Aches and pains are common symptoms of untreated depression. Fibromyalgia is commonly concurrent with depression. It's muscle pain throughout the body, and it can produce many psychological effects similar to those of depression. And number 9, gastrointestinal problems. Gastrointestinal problems are a common subset of issues around the body that depression can bring out. These refer to problems like indigestion, nausea, vomiting, or any other problem in or around your stomach. According to a 2016 study, there's a hormonal link in depression patients and gastrointestinal problems. We hope we were able to.
Mood naturally fluctuates, and everyone experiences highs and lows in their lives. But in some cases, changes in mood can become long-lasting, debilitating, and can impair someone's ability to hold down a job or sustain meaningful relationships. It's estimated that around 10% of people will at some point in their lives suffer from depression, a mood disorder characterized by several symptoms. Feeling sad, distressed, unmotivated, excessively tired, and losing interest in once pleasurable activities known as anhedonia. Many people with depression also suffer from anxiety. Neuroimaging studies reveal that many brain circuits that normally regulate mood are dysregulated in depression. Located deep within the brain, the amygdala processes highly salient stimuli such as rewards and potential threats. In depression, the amygdala is overactive and responds excessively to negative events. In turn, the amygdala connects to a set of brain regions that hone the physiological and behavioral response to emotional stimuli. These areas include the medial prefrontal cortex, the nucleus accumbens, the hippocampus, and the insula. The hippocampus is involved in memory formation, and along with the prefrontal cortex is particularly vulnerable to the effects of stress. Depressed people are more susceptible to stress, which can cause physical changes in the brain, including atrophy of the hippocampus. This and other changes in depressed people may cause inappropriate responses to emotional events. The medial prefrontal cortex is involved in regulating how strongly we react to emotional stimuli. Treatments such as antidepressant drugs, cognitive behavioral therapy, and electroconvulsive therapy affect the structure and function of these and other brain regions. Animal models such as mice are critical in helping us understand the cellular and molecular changes underlying depression and develop better treatments. Although it's impossible to know if a mouse is depressed, mice subjected to chronic stress show some symptoms similar to depressed humans, such as anxiety-like behavior, less social interaction, and a lack of interest in normally pleasurable activities. While not all human depression is triggered by stress, these models may still shed light on the biology of depression, and they're the closest scientists can get while studying mice. As with humans, chronic stress in mice can lead to atrophy of the hippocampus and prefrontal cortex. Mouse studies have also shown altered neuronal plasticity in various brain regions, including the hippocampus, prefrontal cortex, amygdala, and nucleus accumbens. In a healthy hippocampus, experiences can lead to changes in the connections between neurons, resulting in learning. These changes are referred to as plasticity. Chronic stress can reduce this plasticity. Healthy brains also continue to produce new neurons in one part of the hippocampus. These new neurons slowly mature and integrate into the circuitry, where they have a strong effect on hippocampal activity and behavior. These new neurons are also affected by stress. They're reduced in number in stressed brains. These effects may result from reduced levels of neurotrophins, proteins that increase neuronal growth and plasticity. Reduced plasticity may stop the hippocampus from being able to properly regulate the stress response, which may lead to a vicious cycle where stress perpetuates more stress. The hippocampus is particularly affected, but there can be reductions in plasticity elsewhere in the brain, and together these changes could contribute to other symptoms of depression like anhedonia. Whether these cellular changes seen in mice are involved in human depression remains unclear. Most antidepressants available today rapidly increase the amount of the neurotransmitters serotonin and/or norepinephrine in the synapse. However, improvements in symptoms in patients and mice usually don't occur until weeks after starting the treatment. While the reasons for this delay aren't fully understood, prolonged treatment with antidepressants can, over time, act to reverse some of the changes induced by chronic stress, increasing neurotrophin expression and rebooting hippocampal plasticity. Non-chemical treatments for depression, including electroconvulsive shock, also promote hippocampal plasticity in mice. Antidepressant treatment can also reverse stress-induced changes in other areas of the brain, including the prefrontal cortex and reward circuitry. Different treatments may target different regions to improve symptoms. Recently, the drug ketamine was found to have rapid antidepressant effects in patients with depression as well as in rodent models, with effects lasting for days. The mechanism behind this is an area of active research. Ketamine blocks a type of synaptic transmission, leading to activation of a number of signaling pathways and increasing neurotrophin expression. These molecular changes result in increased plasticity in the prefrontal cortex and hippocampus, and likely contribute to ketamine's behavioral effects. By studying the changes in the brain caused by chronic stress and how antidepressants like ketamine work to reverse them, researchers may find new targets for treatment or new drugs that could act more quickly, more specifically, or more effectively than currently available drugs.